Well, welcome back. Studies show back pain is one of the most common health issues in adults. Most people over 55 will experience it at some point.
So is aging a major cause, and what non-surgical treatments are available for chronic pain? Well, Sylvia Casmieta spoke with a doctor from the Dr. Gil Center for Back, Neck, and Chronic Pain Relief to find out.
I'm so happy to have back with us today Dr. Wendy Toohey of the Dr. Gil Center for Back, Neck, and Chronic Pain Relief. Thanks for joining us today.
Thanks for having me, Sylvia.
Okay, let's talk about the root cause of back pain. Is it true that as we age, our spine starts to degenerate?
Absolutely. What happens is the cushion between the vertebra will lose elasticity and hydration. And so over time, that causes a degeneration of the disc. It can even bulge or herniate. But ultimately what happens is that puts pressure on the nerve. And now wherever that nerve goes, that person can have back pain, pain down the distribution of that nerve. So if it's in the low back, it can go down the leg. But it can also cause things like numbness, tingling, burning, and start to create symptoms of neuropathy and other problems down the line.
Well, then let's talk about solutions. Doctor, you have a great one, which is a non-surgical approach called spinal decompression. Tell us how that can help alleviate symptoms of, let's say, back pain, nerve pain, even neuropathy, where we have nerve issues in our feet.
The way that spinal decompression works is it's a very gentle pull, and what it does is it actually handles the cause of this problem. And so it does a gentle pull, pulls fluid and nutrients and increases blood flow to the area, which heals the degeneration, but also ultimately makes space for the nerve. And so as that nerve has room, it can heal. And now pain decreases. Symptoms like numbness, tingling go away, and over time that person can get back to feeling normal.
Let's talk about neuropathy. Is there truly a connection between the nerve issues that are happening in your back, down your feet, and you having trouble walking?
Absolutely. There's specific fibers in the nerve that affect coordination and balance. And so when there's pressure on that nerve, the feet are getting bad messages from the brain. And now those feet are giving bad messages back to the body. And so the brain and the feet lose connection with one another. So you have to start by getting the pressure off of the nerve. And then there's other therapies that you can do to increase blood flow and speed up the healing of that nerve so that you can bring the coordination and the balance and ultimately a person's sense of confidence and independence back. Because when you start to lose balance, that can affect someone's just ability to do their life the way they want to do it.
And that's really a big issue for older adults, right?
Yes, we have a lot of patients who are 55 plus, and their balance is affecting just them being able to take a shower, or some of them can't feel a gas pedal, and some of them don't even necessarily know when I do their exam. They don't even understand how bad their balance is until we really test it. But there's easy ways that you can rehab it and bring it back online. You just have to be able to first identify the problem.
And that's where you have an offer for our viewers to help them with that. Can you share the offer with us?
Absolutely. For the first 20 callers, they'll receive an examination, consultation, x-ray, and report of findings for only $49.
Doctor, thank you so much for sharing this information, for educating us and telling us what we can do to handle these types of situations that are impacting us non-surgically.
Thanks for having me.
I'm going to send it back to you.
Thank you, Sylvia. Be one of the first 20 callers to 615-551-3897 to book your appointment at the Dr. Gil Center for Back, Neck, and Chronic Pain Relief in Franklin. You'll get an exam, consultation, x-ray, and review of findings for just $49. Call now.